Burnout is a huge problem. Women are struggling with balancing their workload and their family life. There's really, in some areas of the country, not only Medicaid, but CVS, no payment for the care that we're giving the children. And you see this in recurrent themes. Not only is the payment for an office visit below Medicaid in some markets from the MCOs, but they don't pay for the G2211. They don't pay for screening for depression. They don't pay you for the Vanderbilts. In Virginia, there's a famous program run by the state for people that make too much money to qualify for Medicaid, but not enough money to be able to afford their own insurance for their kids. That one doesn't pay for vaccine administrations. And you can't use VFC on those children because they make too much money to qualify for VFC. And the state of Virginia reimburses their vaccines at less than the cost than you can get the vaccine through a GPO. So it's not just one player, it's all the players. Apparently, pediatricians are suffering from a lot of mental illness. As you both are mentioning, there's a lot of meaningless tasks that we have to complete. Hoop jumping that has not never been showed to improve care, physician satisfaction, patient satisfaction. It's just something that someone decides is a good idea and then charges me for participating in it. And the worst one to me is BMI reporting. We don't do anything with a BMI reporting. I'm sure somebody at HHS is doing a study, but it's not changing outcomes.
Yeah.
And finally, we had a terrible match this year. And so that's basically where we are. Any additions to my list of grievances, Jess?
I think that the things that you mention are all present in some degree and to greater or lesser degrees. I think that the overall issue is that sort of contains all of that is applicable to pediatrics in specific, but to medicine in general. And there seems to be overall a devaluation of the services that we provide and the care that we provide. Meaningless tasks take away from the important face-to-face care that we do, and yet people don't seem to realize that impact on the actual care that's given during a patient encounter. Burnout is an issue, but burnout is something that is impacted by so many of those things. When you see one person with burnout, you've seen one person with burnout. They're not the same, and the impacts are not the same. I never found EHRs to be overly burdensome, but I developed techniques to get around that. I never took work home and had to work on the EHR at night because I was able to finish it during my workday. But other people I know spend hours of pajama time working on their EHRs, and that's a cause of burnout. We use the term burnout, but really having to take work home like that is what I would call moral injury. I think it is not appropriate that after working 8 or 10 hours seeing patients, we then have to do that kind of work at home. What other profession, maybe teachers who are responsible for lesson plans, but what other profession do you see having to come home and work so many hours on such a regular basis after every time? So I think that the moral injury that's inflicted on medicine for other reasons, we know that EHRs were not developed to provide patient care. They were developed to make billing easier and more comprehensive, to capture charges. And most pediatricians handled the billing themselves pretty well, whether it was a pegboard system or an in-office computer. And now the EHR has so much more documentation that if you don't document the BMI, the visit's not considered complete by the payer and you don't get paid. If you don't document the BMI on the school form, it's sent back to you by the school nurse. And I agree with you. I think BMI or other indicators of weight for height or obesity are important things for us to know, but they're important for us to know when we're dealing with a patient. Unless that information can be gathered and collected and used to change policy and used to change practice, though I think collecting it centrally, as you say, is a fairly useless task. We've collect all kinds of data. We've yet to see any benefit or any use for a lot of it. I think that's an important point, George.
I think all these screenings, BMI, social determinants of health, whoever invented them, if you were to ask them a question, they'll give you 1,000 reasons why it is a good idea. So they come up with the idea of social determinants of health and they put it out. Everybody has to do it. They attach some money to it to make you do it, right? Then you have some management level person that says, okay, let's get this. I'll give you an example with our own office, social determinants of health. Is that a good idea to do? What do you think, fellas?
I think you can't throw all the screening tools into the same bucket.
They're pretty much a screening tool. Let's just talk about screening tools. It's a
But
process.
it's different, right? So reporting BMIs has no
Right.
use.
All right. So
Doing
what you have to do.
but George, doing
Uh,
suicide assessment in kids over 11 years, when it's the number one cause of death in the US for
yep.
children,
Mhm.
has an impact.
Okay.
So
I agree with you.
that's a good
I
one.
agree with you.
Social determinants for me is complicated because it just hurts me. What can I do to change this child's life?
I
But you
agree with you.
cannot look at it that way. You're trying to select people that are higher risk for
Right.
disease burden by knowing these impediments to care.
Correct.
And
Correct.
so that's what you're trying to do.